we don't have to agree on everything, but it's important that we hear each other out and try to come from a place of kind of understanding.
Welcome back to the Faculty Factory podcast, friends. I'm Kim Skorupski, and you've joined in for the Triple H series, The Habits and Hacks from Hopkins. And I'm so pleased to introduce you to our guest today, Dr. Risha Irvin. Dr. Irvin, how are you today?
I'm doing good, Kim, and thanks so much for having me.
So happy to see your face. People know who've been listening to podcasts for years now. I moved away from the Skype version to the Zoom version, and it makes me so happy as an extrovert to see the faces. And I'm sorry, folks in podcast world, you can't see Risha's lovely face, but she's got our beautiful Hopkins Hospital behind her and huge smile, and that just makes me so happy as I still sit here in my basement. So thank you for joining us, Risha. Why don't you tell everybody who you are and what you do here at Hopkins?
Sure. So I'm an assistant professor in the Division of Infectious Diseases. My research really focuses on vulnerable populations and in relation to HIV and hepatitis C health disparities. And so the vulnerable populations I really focus on are underserved communities, individuals with issues with substance use, and incarcerated persons. So my kind of big research project right now is looking at hepatitis C testing and treatment in incarcerated persons and the impact that has on overall hepatitis C elimination as we work towards eliminating hepatitis C. The other things I do at Hopkins are kind of focused on my community work and really engaging with community members on HIV and hepatitis C testing. As a part of that, I work with our Baltimore HIV Collaboratory for the Center for AIDS Research and direct programs there focused on kind of engaging with the community. And we also run several pipeline programs to get individuals underrepresented in medicine interested in infectious diseases and in particular HIV. And then finally, the other kind of hat I wear at Hopkins is I serve as Associate Vice Chair for Diversity and Inclusion for our Department of Medicine, where I'm focused on recruiting, kind of retention and promotion of individuals underrepresented in medicine. So that's kind of a little bit about what I do here.
Exhale, Risha. Yes, everybody can really appreciate. It seems like every time I interview someone here at Hopkins, there's just so much. Everyone is doing so much and wears so many hats and has such passion for what you're doing. So I can't wait to dig in and have you tell everybody like what habits or hacks or practices or mantras or tools have you employed that have brought you to this place, that see you through, that make you successful, that guide you. What are you going to share today?
Sure. So I think, both my kind of research and community work have taught me just the importance of engaging the community around us and letting them guide the work you do and understanding that they're the experts on their community. And so I think that's one of the biggest lessons that I've learned. I think sometimes as researchers, we think we have all of this great training and we know how to solve problems, but really the community knows what issues are important to them. And they have a lot of great ideas about how to solve those issues and how we can partner to forge academic community partnerships to really work on kind of those issues. And so in both my research and community outreach efforts, I've really tried to engage the community and primarily community-based organizations to partner with me and let them guide me to the places that I need to go in terms of my research and help me also think about what questions we need to ask and what are the interventions that will kind of solve the issues that have been identified.
Wow. So help us think about how to actually apply this. So pretend you're giving me advice and I say, Dr. Irvin, I want to engage in my community. And I, Kim Skorupski, have noticed so I'm a gerontologist, so I love aging research. So I have noticed in my neighborhood that there seems to be some older adults who aren't really who seem kind of lonely, and because of COVID, they're like maybe trapped in their rooms in the nearby nursing home or in their apartments, and I think that they're lonely. So Risha, I put together a survey, and I'm going to go into the local area agency on aging and have a meeting with someone there. And then I'm going to say that I have this survey that's going to help, fix these problems there. Would you say that sounds like a great idea, Kim? And that's the perfect way to engage with the community? Or what kind of advice would you give someone about how does one really engage, and what are these levels of engagement?
Sure. So, with that scenario, one thing I would say, what I've always tried to do is figure out who are the leaders in the community and kind of what organizations really know the community. And I try to meet with those organizations or those individuals first to talk about, what I'm kind of interested in and what I kind of think might be an issue, but then to get feedback from them about kind of the vantage point they see it from, or kind of any issues or other thoughts that they have. And then actually often get them to help me sometimes have kind of focus groups or other kind of groups that can help me actually develop what my assessment tool will be. So you mentioned kind of a survey, but getting input from people about kind of even what those questions should be, because again, we go with the questions that we think are important, but sometimes the individuals in the community have a totally different perception. So it's really great to get their input early on. I'll say the other lesson that I've learned is that as researchers in particular, we have to stop kind of doing these kind of one-offs where we hop into the community, want to get some information, and don't really provide anything to the community. So first, I think we really have to think about kind of long-standing relationships. So, my work is in HIV and hepatitis C. And so there are definitely partners around Baltimore City who I know are kind of experts in that area in terms of community-based organizations. And so I try to have long-standing relationships with them that work kind of both ways. So there's sometimes that I bring things to them that I want input on, but they also know that I'm here to help them. Particularly community-based organizations are sometimes looking for input on how to write a grant. And so, that's something I can help them with. And so that it's a two-way relationship and kind of long-standing, and that we can call on each other. So it's not just these kind of one-offs. The other thing that we really tried to do, myself and Dr. Kathleen Page, we work together through the Center for AIDS Research, and making sure that we get results back to people from the research that we do. Because the other thing is we go into communities, we ask all of these questions, or, we test an intervention, but we have to go back and tell people kind of what we found as well. So thinking about ways that we can disseminate that information effectively to communities is really important as well.
Gosh, you've said so much, Risha. I really appreciate this insight, and I think it's so important. And a couple of things that you said that really jumped out at me is this idea of staying away from the one-offs is so fundamental. And I think a lot of us maybe miss this because, our lives, we're wrapped up in the life of the mind in our ivory tower. So we have these testable hypotheses, and we know how to collect the data and the various multi-trait, multi-method ways of triangulating data. So we kind of are convicted that we know what to do and how to do it. But I love how you said we could put a great standardized tools and indices and all these scales and that would be measuring something, but it's not the thing that most matters to the community. So I love how you've raised, these issues. And in the example I gave, my perception that they're lonely could be completely off base. So I could be putting some blah, blah, blah loneliness scale in, and it would measure something, but it's not maybe loneliness, maybe it's anxiety, or it's, no accessibility, that they're not lonely. Maybe they have put together some internal social networking in groups, but I, through my lens, am placing some perceived judging on there. And so I love how you said you meet with as many people as possible. You look for input, you listen via maybe focus groups. I think that is so important. And then I love the example you said, talk about the quid pro quo, like what can I provided them. This is not transactional, it's transformational. So where you're trying to build relationships, yeah, it's both ways. And so many times do we hear people say, oh yeah, you're just the flavor of the month or the year. You're just some new, excited, enthusiastic professor. Good for you. You're going to do a survey. You're going to do a whatever. It's going to be a lot of activity, a lot of commotion, and then we're never going to hear from you again.
Exactly.
And nothing can really destroy or deteriorate that trust. I mean, that's part of this thing is trust, right? So
exactly.
I imagine you, through engaging purposely and having a continued presence, that's how you build the trust, right? How have you seen examples of where trust has been eroded from maybe a predecessor and how you've had to build that up again?
Sure. So that definitely happens. And I think, if we look around our East Baltimore community, many people have been involved in different research studies through, our major academic institutions. And, everyone hasn't had a great experience with those research studies before. And some of that's just because, people feel like information was never communicated back. The other issue I think I found sometimes with our community-based organizations, they'll say, well, you did this research, you showed that this intervention worked, but then, there's no follow-up to that. And so one of the things that we talked about to our community members about is, the interventions that we test are often funded by, scientific research in terms of the NIH. And, there's not money for necessarily implementation of that. And so we've talked about kind of what the model is to fund research. But I think once we find that something works, one, we've got to disseminate that to the community. But then also, again, partner with our community-based organizations to sometimes help them get implementation dollars from foundations, from the city health department, the state health department, and others, because I think it's also important that our research actually does something. So we don't want to just prove interventions work and it really goes nowhere from there. We want to actually see that implemented. And so I think, the area of implementation science is important, but also helping our community-based organizations implement the interventions that we found to be effective. And so, again, I think that takes a lot of partnership with them to help them get some of those implementation dollars that sometimes come from foundations or health departments, and is different from our, scientific kind of research funding as well.
Yeah, and that is such a challenge, the final stage of that implementation of the recommendations and then sustainability. And you're reminding me of some of my work back in the day where I think there was, and part of this relationship building was where when I worked with CBOs in Erie, Pennsylvania, it was around teenage pregnancy prevention. It was for an applied research center when I worked at Barron College, part of Penn State campus. And there was this, and it goes both ways again with relationships in the community. I had this distinct feeling that a lot of the nonprofit leaders that I was working with assumed that we're Penn State. So we have I had this maybe limitless credit card, or I had millions of dollars that I could write a check on.
Exactly.
And they think I was probably making, I don't know, $500,000 a year. And little did they know that I was making, $40,000 a year, and I'm scraping by and I don't have access to money. I don't even have an expense account. And I'm traveling to you on my own dime. And even here at Hopkins, I'm sure Risha, people think that, you work at Hopkins, you faculty have so much money. I'm thinking, no, Hopkins. And you don't know this, and most people don't know this, but our salaries, according to AAMC salary tables, we're the 20th percentile nationally. Please do not say our faculty members make a lot of money, because they don't. So there's a kind of that, while we can be humble enough and recognize that we are not the keepers of all truth in the community, there is a kind of reciprocity of helping them to understand that I, Dr. Irvin, am not then deciding who of you is going to get money, because I'm not sitting on a pot of money.
Exactly.
So that kind of education is, they think that we just have access to, or we get these grants like crazy. And then maybe sometimes they would then point a finger, well, you did all this work and then she left us high and dry. And then Dr. Irvin became the dean of something, and she just took off and left us. That she didn't, give us the $500,000 to actually implement this. So How have you seen
Exactly.
that play out? And how do you build that, again, the relationship and the trust and the education and the understanding?
Yeah, so that's one of the things when I've worked with community groups that I've tried to explain and also be very transparent about what I can do and what resources I do bring to the table and what I can't do and don't have control over. And in particular, if it's a research project I'm talking to them about, I really talk about, what my funding is for and what it can fund. And then what I can't do in terms of that kind of research funding, because I do think it's very important that we let people know from the beginning what we're there for and what resources that we have. Because I think people do feel like when you come from one of these big academic institutions that you do have access to lots of funds and kind of money to spend and to implement. And we don't, our money is typically coming off of research grants and a very defined focus in terms of what those funds can be used for. So really important to let kind of communities know that. It came into play really as we transitioned into COVID-19 as well. And one of the things I do is run a community group of faith and community leaders to keep them updated on COVID-19 health disparities and vaccines and some of the vaccine science. And, in our initial discussions, a lot of talk came up about, kind of the funding and who's funding the vaccines. And so one of the discussions we had, and I think being very transparent about, what we could do at Hopkins and what we were doing, and that, in terms of kind of the national level, that we weren't controlling those things. But again, very important to be upfront and honest and transparent about what role we can play. One of the things that I do think as we transitioned into COVID-19 with our faith and community leaders, many of us that worked in this space throughout the pandemic and kind of ongoing now, we had existing relationships with many of these organizations. Again, my work based around HIV and hepatitis C, but many of my other colleagues in kind of different fields. And so that there was this level of trust as well that kind of was already embedded in the situation, which really helped. But, we've also had very frank discussions as well. But I think there was a mutual understanding and trust on both sides because we had an ongoing relationship with each other. And so, again, I just think that's really important.
Yeah. So this is beautiful. And this is painting a picture for me that back to, you said at least twice now, this transparency is that I'm kind of likening the situation to when you have these embedded relationships. And then when we, as an investigator, clinician scientist, community scientist, as Panagis Galiatsatos was talking on a recent episode about, physician community. What does he call it? He had this great term, and I actually wrote it down. I love it. But this idea that physician citizen, Panagis says we are physician citizens, is that when there is this presence that is not the one-off, when we invite our colleagues, our Hopkins colleagues, or fill in the blank at your institution, when we talk about our work, inspire and encourage and really elevate this work and the possibilities with other colleagues, there's more. It's not just me, that it's not just Risha Irvin doing this. You're part of the team, you're part of the family. So that relationships, those series of embedded networks have become so institutionalized in the community that even when Dr. Irvin flies the nest and, moves on as life's journey and season takes her somewhere else, just like in a family, our dear sweet Risha moved away. Doesn't mean she's not part of the family. She's flown the coop, she's spreading her wings, and there's still, the nest is there. So you're not, when it's a one-off and it's you alone and you're the lone wolf, then you leave and there is that vacuum. But I think when we invite community, literally community, but our Hopkins or our university community to gather together, there's that power and that sustenance and sustainability so that when one person does move on, it's not a slap in the face to the community that I can't believe Dr. Irvin did all this work and then she up and left us.
Exactly.
I've had that experience of moving around, and I felt terrible that felt like I was leaving a community, a vacuum. So the way you've described this is that this legacy is not just it's not a dry, a once in a while thing. It's a permanent structure, and we can help that permanence by inviting more people.
Exactly. It's really important to have, I think, multiple people at the table. So not just one person is seen as the person at the institution kind of that does this work, but having a whole team. And I'll say, again, with kind of COVID-19, we had a health equity group under Dr. Sharita Golden, and she brought many of us together from different fields to be a part of this work. And so I think we were all able to bring our kind of different connections. But again, very important. So not just kind of one person is seen as kind of the link to this work, but so many of us kind of came together to take on an issue and then collaborated with the community as well to kind of think about COVID-19 health equity.
And isn't what you're doing just these one-on-one connections and this building relationship and this authentic, genuine, transparent engagement? That is then, it's not just, Hopkins. We don't trust Hopkins. Now it's a Sharita Golden. It's a Risha Irvin. So yeah, they're Hopkins, but now I know her personally. So exactly. the trust is at the person level. And maybe it's not, I don't trust the government. Well, who are we talking about the government? You trust this guy or that woman? Well, she's all right. But it's the fill in the blank, or that group of people, or those kind of people. When you get to take the time, or when we take the time to know the person at any micro level, the community, the neighborhood, the block, the house, the family, the person, wow, that just tears away all those labels that we so easily kind of check off the box and say, don't trust Hopkins, those scientists,
Exactly.
Tell us something else about your diversity role as the associate vice chair and how that evolved and how you're navigating that role, especially during this crazy time, and how you're juggling that with your really cool work with, Hep C and HIV.
Oh, sure. So I had been a part of the Diversity Council for the Department of Medicine for the past few years, and assumed the position as Associate Vice Chair for Diversity and Inclusion, and then Chair of the Diversity Council back in March of this year. So still fairly new to the role, but really excited to take on this work. And again, focused on recruiting and then retention and promotion of individuals underrepresented in medicine. Which I think, as we think about the Department of Medicine, that's kind of a lot to take on, but we have a lot of great faculty and trainees in our department that are really interested in these ideals and, have a vested interest in equity and inclusion and diversity. And so we have a whole team kind of working on these issues. So really, it's a really exciting time. I think, for us, a part of that is making sure that we expand the pipeline of students, underrepresented students who are coming to our medical school, coming to our training programs, because really that's where you kind of get most of your faculty from. And so I think one of the things we're doing is taking a broader look at kind of the pipeline and how we start kind of early on recruiting people into internal medicine and thinking about, several of our kind of divisions and what people can subspecialize in. It's a really focused kind of on that. I think one of the other overarching issues is just how we build a sense of community. And so thinking about ways to do that, in particular, thinking about how you do that during COVID, because, people are pretty zoomed out, I'll say. And so trying to, cultivate kind of relationships for people. And so thinking about kind of smaller events and how we do that so that people feel like they have a connection to each other, particularly our new faculty that have started over kind of these last 2 years, kind of during the COVID-19 pandemic, because I think it's really easy to feel disconnected. And so how do we bring kind of people in to the fold? I think other issues, just making sure that, we retain our URM faculty and trainees, and then making sure people get promoted as well. I think even, my own experience doing a lot of kind of community work and how that translates into academic scholarship at an academic institution. And so making sure that we're helping people kind of navigate any of those issues that kind of might come up in their careers as well, so that we make sure that we're valuing all types of kind of scholarship in our kind of promotion pathways as well. And so that's another area that we advocate for.
This is a personal question, but what kinds of things can we do to retain faculty, period? I have so many things that I've been harping on, since I've been here. And to me, as a faculty in my faculty development hat is resources. I always feel like we are under-resourced. And when I talk to faculty, my heart just busts when I, just before talking to you, talking to faculty members who are knocking out of the park, 4 grant awards, and they're still doing 4 inpatient rounds per week. And don't worry, next year we'll kind of back you off of that, and we'll get you down to 3 next year. And in the meantime, I just got a K-23 that's paying for 70% of my salary, and I got 2 foundation awards, and I got this, and I got 3 R01s in the pipeline. And how can you be doing this? And this person, they don't have any admin support, and there's, they're, boarding, they're rooming and boarding and their own patients, and they're calling the pharmacy. And I just, I immediately want to jump through the Zoom screen and say, well, I'll do it. I'll transport your patients for you. You don't care about that. But so my big thing is always resources. And I realize that I am extraordinarily ignorant about the literature and what other things we can do. But Risha, I'm all about building, small communities of engagement, like through my WAGs, the Writing Accountability Group. And this podcast is all about building community. But I still so oftentimes feel helpless. Like I can only do so much. But as an institution, as a department, as a division, as peers, can you give us a couple things that we can all think about, even if we're not doing them here at Hopkins? Like, what might we start thinking about practically doing other than having Bloomberg give us $1 billion to make sure people don't leave?
Yeah, I know. I mean, it's definitely hard. Academic medicine, I think, for particularly people who are being clinicians and trying to maintain kind of research, it's a hard balance, I think. There are a couple things that I think that are helpful, and I think there are things that others have identified. So one, I'll say, mentorship is huge. It's been huge for me, and I know several, my other colleagues, and it's such a big issue. And so I'll say, in me coming to Hopkins, I actually was in kind of HIV policy and decided to transition into an academic career. And I'll say for me, staying in academics was probably largely in part due to my division director, Dave Thomas, who is my direct mentor as well. And, I think really took me under his wing and made time to meet with me, on a regular basis, which is really important. So many people who are very senior here are really busy. But I think, if you're going to have a mentor, and work with someone, it's important to make time for that person to understand what their strengths and weaknesses are, and help them kind of grow. And so I think, Dr. Thomas has really helped me do that. I think the other thing that was really important in my kind of mentorship with Dr. Thomas is that he asked me a lot about what I wanted to do or where I wanted my career to go at Hopkins. And one of the things he said to me, I may not be an expert in everything that you want to do. His expertise is in infectious diseases and hepatitis C, and has really helped me advance my kind of research. But he said, if there are things you want to do at Hopkins that, I'm not the expert in, then I will make sure you get to the people that you need to meet with and get to know. And so he also was really helpful in making introductions to many different people across Hopkins and getting me access to, senior level people that could help me in kind of different areas of my career, including, the work I wanted to do in diversity and inclusion as well. And so I think that's really important. The other thing that's, not just mentorship, but sponsorship. And so making sure that individuals in your division or department are getting recognized for the work that they're doing. I think when you're junior and you're doing, your clinical work and you're doing kind of research, sometimes it gets hard and you feel like, you're not being kind of recognized for anything. And so trying to make sure that you don't have to be a person's mentor, but that you can help in terms of sponsorship. And that means, saying that, they should give this talk. If someone reaches out to you as a senior person and say, I know somebody else who would be great to give this talk, and, getting, a junior person to be able to give that at a national conference or, something like that, or nominating a junior person for an award so that they're recognized. Particularly at big institutions like this, it feels like sometimes there's so many people doing so many great things. And so how do you get recognized for the things that you're doing? So I think sponsorship is a big piece of that. I do think the other kind of role that, department chairs and division directors can play is just continuously advocating for resources, though. And so I think that's in terms of kind of space resources. So making sure that faculty have, the offices that they need, or kind of have space for their research assistants to have somewhere to sit. But then also financial resources, in terms of kind of salary support and what that looks like. Because again, we are competing with other institutions to retain our faculty. And so in order to do that, we do have to be competitive. And, finances are a part of that. People have trained for a long time, and, people don't go into medicine to make, bukus of money. But, a lot of people have loans. Both myself and my husband, we took on loans to go to medical school. And so, the financial piece is a part of it when you think about people kind of raising their families and wanting to provide opportunities for themselves as well. So I think we do have to continuously advocate for those resources as well.
Very well said. Very well said. Mentorship, sponsorship, leaders advocating for resources like space, time, money, so important. And what is one of the important things about what you said is when you started talking about mentorship is that, they're so busy. And, the leaders, the senior leaders, yes. And, part of me gets kind of like annoyed with mentors, like, yeah, you're busy, but that's that's what you signed on for.
Yeah.
When you're a faculty member, you got to make the time. So these kind of like flyby mentorship arrangements, I get so annoyed when I hear of like, do you have a mentor? Yeah, I do. Well, when was the last time we meet quarterly kind of. What do you talk about? Well, we talk about RVUs. He talks about his this or that or the other. Or she mentions, what she wants me to do. That's not real mentorship. So, yeah. I mean, to us, here at Hopkins, Risha, we have all these mentoring programs, and Dr. Jennifer Haythorne-Thwaite is our like mentor Sherpa. She does all these mentoring programs and workshops for about the T32, the training programs. And we spend a lot of time trying to help skill up or train up mentors and mentees, that mentees are proactive and don't feel shy about, well, she's so busy, I don't want to bother her. No, you get on their calendar, you own the agenda, you need it, because of course they're busy. Hello, everybody's busy. Exactly. This is the cult of busy. We all are. I have never met a person yet in academia who's like, no, I got nothing going on. Yeah. When you want to meet, whatever, I'm doing nothing. Nobody says that. So, and then the other, side as for the mentors, no, I don't buy it that, well, I'm mentored out and I'm just going to kind of superficially be that. No, when you're in something, do it right, because this is somebody's, and if you can't, then be honest about that. Back to your transparency thing, but be transparent about, I can give you this level of mentorship. I can meet with you this often, and this is what I expect from you. This is what I need from you, Risha. I'm like in the middle of a big U award, and I would like to do this, but for the next period of X number of months, I'm going to need very focused emails from you, but it's going to be really, so just that, again, communication of setting clear boundaries, clear expectations to maximize the time. Let's not waste time. So I'm so happy that you brought that up. And let's talk about real mentorship, real sponsorship. And by the way, sponsorship can come from our peers, right? We can always use opportunities to say, hey, Kim, I didn't realize that you do this kind of work. Next time you do this and such, I'd be curious. I'd be interested in doing it. Would you mind? And I'd be absolutely. I keep lists of faculty who are interested in certain things and, asking our friends to nominate us for an award or to give a talk or something. So that's my kind of my bugaboo, my little personal, I guess, kind of thing that gets me all crunchy is when I have faculty members who'll talk to me and they'll spout off like 5 mentors, but to me, there's no real depth or gravitas to those relationships. So I love that you're emphasizing the mentor in the various connecting, meeting, furthering, thinking about your career, and like how Dr. Thomas said, hey, I may not be the content expert, but I can certainly connect you to somebody who is. So good points. Good stuff. Anything else you'd like to share with us? I get so excited and I love the things you're saying. There's so much value here. Would you like to share any other habits or hacks or way of thinking or being or messages to the folks who are listening?
No, I mean, I think that's about it. I guess the only thing I would say is just that, as we all work to create a more kind of inclusive and equitable environment, to always just try to see other people's vantage point. We don't have to agree on everything, but it's important that we hear each other out and try to come from a place of kind of understanding, because we all carry our life experiences, which sometimes, provide certain biases that we all carry. And so, always being open to explore your beliefs and other people's beliefs and doing it in a respectful way. And so I think if we all do that, we'll all be better for it.
Oh my gosh. Very, very well said. Dr. Irvin, it's been a delight. I want to thank you so much for being on the Faculty Factory podcast. How can folks get in touch with you if they want to learn more about how does a new Associate Vice Chair for Diversity and Inclusion get that role, and about your HIV Hep C work in incarcerated populations or anything like that? How might that get in touch with you? What's your email?
Sure. Yeah. So people are welcome to always email me. I'm pretty good on kind of email. My Hopkins email is rirbin1@jhmi.edu. I'm happy to always take any kind of emails and answer questions about the work I do or anything else.
Well, this has been great. Again, Dr. Risha Irvin's email address is RIRV as in Victor, IN1. rirvin1@jimmy.edu. That's jmi.edu. Risha, it's been wonderful. Keep smiling. I love your energy. Stick with us. Don't go anywhere. We need you here. Not that you're going anywhere, anybody. I'm just saying. I love talking to people, and I want them to stay and stick. And so thank you for the work you do. And next time, folks, tell everybody about the Faculty Factory podcast, and we'll talk to you later. Thank you, Risha.
Thank you.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more, get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.